we're still trying to figure out the correlation between is it genetic, is it environmental. In theory, the assumption it has to be a combination of both, because when we look at subset groups separately, looking at African Americans, and then you look at people in the Caribbean, and we look at people on the continent of Africa, there are still increased pockets of risk in all those groups. So there is a genetic process in it. Now, obviously, in the Caribbean population, some of it may be a screening why their numbers are not as high as here in the US, because they may not screen differently. So that may be the change, but really clearly there has been some suggestion that it is genetic driven. It is a difference in men of sub-Saharan African descent versus North Africa. So there is clearly something and like anything you say, genetics, it's like having dice on a table. You throw them, and they may not show up anything. You keep mixing them enough, and eventually one of those combination triggered by something environmental, triggered by something we eat, something we work, something we breathe. Nobody knows what that connection is. There used to be a theory thought of that it was clearly a socioeconomic thing because African Americans' access to healthcare was slower and so forth. Some of that data is through some work by Dr. Powell at Kermanos has shown it's not really that way, because if you look at African Americans who live in the suburbs, their risk is just as high. So it's clearly not just an access thing alone.